There we go. It's a little blurry.
I would be wearing glasses, but I fogged them up, so.
That's what I say in practice, too.
Wink.
I'm kidding. Okay, so we put on the O2 set just for good luck.
I'll watch it for you. You gotta put that.
Alright, that's fine.
What?
Nothing.
Oh, you're just cleaning the dressing?
Yeah.
Okay. Yeah.
Oh. Not that.
Yeah. No, she's cleaning that too. Are you cleaning that too? Yeah.
Oh, I pour my shit first.
You can't pour it without being sterile.
Oh, yeah.
The kits will be in the right order.
I could do a phenomenal job.
Okay, well, I swear I didn't. Never mind.
Those gloves bother
Yeah, I
me
would
so
just bring
much.
in another pair.
bring my other pair.
That's alright.
Would you bring in 2 trays, just in case you...
I bring in 2 of everything.
Everything?
I'm usually overflowing. We'll pretend it's not.
This is fake life.
Yep. Hey, Larry. His name's Larry.
Hey, Larry.
It's actually Ricardo.
Ricardo.
Well, you got the wrong patient.
It's okay. He still has a trach. He needs it cleaned.
Doesn't matter who you are. You're gonna get clean today.
Oh, and I always put forgot to put the plastic side on the bottom. So you
Shiny
can't
side
really
down.
see.
Shiny side down. Why does it matter?
Because the shiny side, the paper side allows for the water to collect and soak up, and the plastic side keeps it from going anywhere. So if you put plastic side on the top, it just rejects the water and it goes everywhere.
Thanks.
Would you,
You're welcome. Now you never forget.
you'd only use that for suctioning?
Yes.
Yeah,
Bag.
I would use that for suctioning if sat drops. It's good. You should have it at the bedside, though.
Would it
For
be at
any
the
trach
would it be at the
patient.
bedside?
In practicum or in real life?
Practicum. And real life.
It should be at the bedside for practicum, just like suctioning would be, which is right there.
But you would have to walk in and remember that it has to be there. And, say that it's not if it's not.
Yeah, well, in real life, you would hopefully notice right away, but in practicum, you're going to be, you'll notice it when you need it. You'll notice it's not there when you need it. Or when you remember. And as long as you state it, that's good.
Yeah. You didn't use that?
So now we're pouring normal
We
saline.
opened mine and mine was malfunctioned. It was like one of the ones where you combined them.
Oh, no.
Oh, mine was that.
Yeah, mine was malfunctioned.
Mine was not that.
And she was like, just keep going.
So if you had a taller garbage can, you always want to make sure to not... No, it doesn't, not even that. You just need to maintain your sterility. It doesn't, you know what I mean? Because you're dropping it so high above the garbage, it's perfect. But on the higher one, you want to make sure that you're still above it. So with this, even though you're sterile, you don't want to touch the part that's going into the trach.
She looks so serious.
I get nervous. I'm practicing.
I do too. Her fingers out. It's perfect.
And then you drop it in here.
Right.
Yes.
So you don't want to put peroxide in someone's throat.
And then you just
You can imagine that would be uncomfortable.
You could.
clean it.
Yep.
And you bang it against the side.
Yeah, because you don't want to put water in there either.
Right. And then
Professor Floto said we can use the
Things
things
if
to
you-
dry them.
If you want to.
Yeah, I
If
like
you
to do
want
that. Up to you.
and then at this point, it's just clean when you're doing.
You're contaminating one hand, aren't you?
Yeah, you're contaminating.
this hand.
Yeah.
Yeah. Technically, you both are
They said
contaminated.
too, this might be a good procedure to bring someone with you. I think. Was it this one? One of them. She was
Might
like,
be the
bring a
suction
friend.
one. Oh, and some of them have the dots and some of them
And she said
don't.
at this point, you just have to be clean anyways, I think. So,
Put the
Right.
oxygen back on.
So the only thing I would do different from that maneuver of yours is hold this study here.
Okay.
Okay, because you want to You don't want to hold their head. You want to hold this because
Yeah, I was
you're jostling their throat.
I was just doing
And
that because of the angle.
no, I
in
totally
real
get it.
life,
I'm
yeah.
just saying because it's an awkward angle with the chin.
Yeah.
Would you lower the bed in that case for the head, or because we moved the pillow?
Either way, this angle's not changing.
Yeah.
So, and
So
it just
Professor
is
Floyd was, like,
because
holding their head in the
exactly. So, yeah, that's the only thing
Okay.
I would change about that.
Okay.
And then you're just clean and you
And
just
then
remove
yeah, she
everything.
said at this point you're just clean anyways.
Yep.
So
So you want to change the dressing too, right?
yeah.
Yeah. So just
She said you could take the oxygen off for this part, like if you're quick, or just move it to the side.
I'll just go like this.
And then you just want to
Oh,
assess
you
it
would
for
move-
like
you
color
would
and
change the dressing
drainage
for this
amount.
too?
Yeah.
Oh yeah, they're usually really like goopy.
Yeah, so you just check in
It's
color and
gooped
amount
all
and
around.
whatnot. And then-
Yeah.
Is it? Never mind.
Yep. So I would do like a third of a swipe, a third of a swipe, a third of a swipe. You know, garbage.
Is there a priority? The dressing first or the trach first? Cleaning wise?
You would suction first.
I would change that first. Change clean the inside and then change the dressing because if they're like have a lot of secretions, you can have it
pouring out when you pull it out.
yeah. Plus like when you take that out, they could still be coughing.
Would they have a scenario where it's suctioning and then cleaning?
It's too much time
much, right?
and too much anxiety. They're not going to do it to you. They don't want you to have anxiety.
How do you like sneak this under so like you're not touching a million different things with it?
It's actually really hard. I didn't like this part.
That's why I think she said bring a friend.
I feel like I'm like
I want a friend. Call a friend.
Phone a friend.
Phone a friend.
Please. If only that was an option.
Oh my god, that'd be a great option.
On an exam.
And your little like PCA could walk in.
Yeah. So, yeah. And,
just lower the bed.
Yep. Since they don't give you trach ties, I wouldn't change the trach ties.
Yeah, they said that on the practicum they would give us somebody who had like one of the collars, I think. I
Okay.
think that's what she said.
Loose?
Well, this is actually what's preferred.
Yeah, the collar, right?
Yeah.
The Velcro.
Yeah. Otherwise, you're tying things and
They said they don't even use those anymore.
Yeah.
yeah, no. But we had them for ours. All right. Good job, Ricardo. Woo. Bravo. Really, bravo. Oh, and we wear PPE in case they cough on us.
Because that can be nasty, she said, if someone gets all that.
That's disgusting.
Take your mask off last.
Yeah. Of a cold.
Oh,
so.
that- we're not grading her on her PPE.
I'm just
removal
making a
right now.
statement. It was
Okay.
a test question.